Hello guys, my name is Julie Wawira. I'm a pelvic floor PT. I work at Lymph and Pelvic Care Kenya. So today we are going to talk about pelvic organ prolapse. What do we mean when we talk about a pelvic organ prolapse? It could be one or more organs dropping and coming out through the vagina. So today we have a model, and this is our model. This is basically how we look like. I look like when I put my pelvic like this. Okay, so when you look at this one, what do we see? These are the organs which are the common. This is the uterus, the rectum, and the bladder. This is the bladder. So what do we see here? These are basically the muscles. The red part is the muscles that hold the pelvic area. So when you look at it, what happens to the organs that we get the prolapse? It could be, the causes could be childbirth. When you get multiple childbirth, it tends to weaken the muscles around it. And when they are weakened, the organs try to find their way out. So when we see the organ like the bladder, when it tries to find its way through the vagina, the front walls of the vagina, it's because of the weakness. And when we look at the rectum also tends to find its way through the back walls of the vagina. And when you look at the uterus also finds its way into, it descends into the vagina. So today we are going to look at the causes. We've mentioned one, multiple childbirth or heavy babies. And the second one could be age, menopause. It lowers the estrogen. The third one is obesity. And when we look at the fourth one, maybe chronic constipation or chronic cough. Okay? When you get that constipation, you tend to strain to move the bowel, to get the bowel movement. That also is also a cause of the pelvic organ prolapse. So today again, we want to know what are the symptoms. Many of us could ask, what are the symptoms of pelvic organ prolapse? One, you feel like there is heaviness down there, like heaviness or pressure around this area, okay? And another thing is the bulging. The organ tends to, you feel like there's a bulge. That organ, you feel it when you go to the restroom. Okay, the third one, the third symptoms could be the low back pain. You experience low back pain because of the weakness. The muscles have become weak. And the fourth one is the multiple surgeries. Okay, so basically that is what I call the organ. What are the symptoms of organ prolapse? So when we talk of all these things, many will want to ask, what is the treatment? We will work with the physiotherapists for conservative treatment. We teach you on the pelvic floor muscle strengthening and a lot more at Pelvic Lymph and Pelvic Care Kenya. We are located at 3rd Parklands, Park Medical Center, 2nd floor, room 205. Come get a solution.